Bismillah ar-Rahman ar-Rahim. So now you have finished taking the patient history and examination. You also requested certain investigations to help you reach the appropriate diagnosis, and you decided the appropriate treatment plan after discussing it with the patient. So now you are going to present this case to your supervisor or to your colleagues in order to discuss the diagnosis and the treatment plan and to see if we can proceed with this diagnosis and treatment plan. So I'm going now to give you some case presentation. And of course, all the data that are presented here are fictional. Just to explain to you how exactly the case presentation is done within the clinical setting. So let's start by saying the following. You can say my patient name is RS. She is 43-year-old, married, unemployed. She came today complaining of pain in the upper right jaw, and she pointed to the premolar area. This pain is mild, started few months ago when she drinks cold. It doesn't disturb sleep. It's relieved by paracetamol, and it's not associated with any other problems. Upon taking the medical history, she explained that she was hospitalized at the age of 6 years for tonsillectomy. She doesn't have history of blood transfusions. However, she is allergic to penicillin. She is currently hypertensive, controlled by 50 milligram atenolol PO per day. And she also has DVT controlled by 5 milligram warfarin PO per day. Upon taking the dental history, she explained that she had fillings and she also did scaling and extractions. However, no complications were reported about extractions or surgery in general. The family history, she has a hypertensive father and her grandfather had colon cancer. Her social history is the following. She is a smoker of 15 cigarettes a day for the past 10 years, and she started to use e-cigarettes 6 months ago, hoping to help her quit cigarettes. She drinks fizzy drinks daily. She's a praxist, and she brushes her teeth once daily, but she doesn't use any dental floss or mouthwash. I will start now by explaining the extraoral examination. She has mild pain in the right TMJ. She also has clicking in the right TMJ and deviation to the left upon opening. The right temporalis is tender. However, there is no cervical lymphadenopathy, and I couldn't detect any other abnormality. Upon examining her intraorally, I found that she has mild gingivitis with calculus on the lingual of lower anterior teeth. She also has a partially depapillated tongue, which I suspect to be erythematous candidiasis. I also examined the teeth, especially the area of her chief complaint, and I found that she has proximal caries in the upper right first premolar. She also has multiple carious teeth, and she has a partially edentulous area in the lower jaw and a badly broken lower left third molar. Therefore, I would like to do the following investigations. I would like to do a panoramic radiograph to have a more closer look at the condition of the broken wisdom tooth. I will also request a periapical X-ray for the upper right first molar in order to see the depth of caries and whether there is a periapical lesion. I will also do a cold test for the upper right first molar. And for the tongue, I would like to do a swab for candida culture. And I would like also to request a complete blood count because she may be anemic and this may have predisposed to the candidal infection that she has. Based upon the investigations and the examination, I can give a preliminary diagnosis of the chief complaint to be reversible pulpitis in the upper right first premolar. And based on that, my treatment plan is first to refer her to perio for scaling and polishing because she has mild pain and this can be postponed, or treatment of her carious tooth can be postponed. Then I will refer her to operative department for treatment of the upper right premolar. I will also refer her at a later stage to oral surgery for removal of broken third molar. And then I will refer her to oral medicine for further investigations and treatment of the depapillated tongue to see exactly whether this is candidal infection or atrophic glossitis or something like this in order to give her the appropriate treatment. Now you have finished the presentation of your case. Remember that you should always mention the patient's name and age upon presentation. You shouldn't start by saying this patient has, for example, dental pain, or my patient or she has, for example, bleeding gums, or and so on. Always introduce the patient properly to your supervisor. Mention the name and age. Be respectful while talking about the patient's history. You should also assume a right posture. You shouldn't present the case while you are sitting. You should always be standing up when you present the case. Don't put your hands in the pockets of your white coat. And also remember that you should always perform good cross-infection control. For example, you shouldn't use the gloves that you examine the patient with to hold the patient file. So make sure that also the pencil or the pen that you used is not also, you don't hold this pen with the contaminated gloves, because this is an area where there is usually some confusion between students regarding the adopting the proper cross-infection control procedures.